good for lowering blood sugar. And I'm going to talk about advanced testing that's really, really helpful for not only detecting diabetes, but pre-diabetes and even before pre-diabetes, and the markers that are essential for that. It really is true prevention and treatment as well. It's really what individuals need to know. We will run a panel that's a very detailed cardiovascular and diabetes panel. I'll talk about the diabetes part first, pre-diabetes, and like I said, even before pre-diabetes. So this has a pre-diabetes assessment. It's measuring insulin resistance. Also, a fasting glucose, fasting insulin, and your hemoglobin A1C, which is your blood sugar over the past 3 months. Fasting insulin is very, very important because it's the first thing that's going to be elevated before the fasting glucose. Because if glucose gets too high, which is your blood sugar, before it gets too high in the bloodstream, your pancreas is going to secrete insulin to compensate for that. So everything else can be normal, but if we have a fasting insulin, we know to intervene early. And again, that way we can even prevent pre-diabetes. True prevention, it's fantastic. So the reason diabetes is so destructive to the body is because high levels of blood sugar damage the blood vessel wall. And everything is fed by our blood vessels, whether that's our eyes, our nerves, our kidneys, our hearts, our extremities like our feet. That's why in diabetes, you see amputations, you see heart attacks, you see strokes, you see kidney disease, numbness and tingling, and you see blindness. Because that blood sugar is damaging that blood vessel wall. And again, damages all of those organs and systems of the body. So it's just so important that we keep the blood sugar levels low, stay away from insulin resistance, and we want to keep the fasting insulin low as well. This is a great picture. This is depicting what a blood sugar crystal does to the blood vessel wall. And that's exactly what that is right there. That is sugar, and I love how this explanation, it depicts it like a piece of broken glass. So sugar in the blood is like a piece of broken glass tearing at your artery wall. That is what causes damage. Too many people, and why I love giving this lecture, is they have been told that cholesterol causes heart disease. But it does not. It's high levels of blood sugar and it's high levels of inflammation. I'll talk about that later in the cardiovascular part, about the high levels of inflammation. But it starts with high levels of blood sugar, damaging the artery wall,